Welcome back in. Surgeries in general can seem scary, and when the heart is involved, it can mean a whole other level of worry. Well, joining us today is Dr. Alexander Ghannam, a ProMedica cardiothoracic surgeon, to talk about what these procedures involve and even some of the advances in technology. Thanks for being here today.
Thank you for having me.
Okay, so it's a big word. What exactly is cardiothoracic surgery?
Yeah, so cardiothoracic surgery is all operations on the chest. So it's operations on the heart, operations on the lung, the esophagus, ribs, or any other chest operation.
The important part. There's a lot of things that we need in this area. So what are some of the more common procedures then?
So my practice focuses almost exclusively on cardiac operations. The most common operations we do are bypass surgery. Most people have heard of or know somebody who's had either triple bypass, quadruple bypass, or some operation like that. We also do operations on all the valves in the heart. So you have 4 valves on the inside of your heart, and there are different operations to repair or replace each of those valves. We also do surgery on the aorta, so some people can develop aneurysms of the aorta, the main blood vessel that leaves the heart. There's a number of different operations we can do to repair those aneurysms or replace them entirely. One of which would be called the total arch replacement and frozen elephant trunk, which we're one of the main people who can do. Yeah. We can also take out cardiac tumors or other masses that obstruct blood flow inside the heart, which are a little bit more rare. And we can also do operations for people who are in heart failure to assist their heart.
So I think, as you mentioned, you may have heard somebody who's had triple bypass, quadruple. Do you have to do like a full open heart? Is there minimal invasive procedures that can be done, or is there that technology out there?
Yeah, definitely. So all the patients that we're considering a heart operation on are seen by both a cardiologist and a surgeon. And depending on their anatomy or what they need done, once we're on the inside, we make every attempt to do things minimally invasive. So for certain valve operations, we're able to make a little incision in the chest and repair or replace valves. Typically, people need bypass operations. We are doing those through standard incision, or if they need operations on their aorta, we're doing those through standard incision. So we are able to do some operations with minimally invasive approaches. We are also able, in conjunction with our cardiology colleagues, to do some minimally invasive valve repair and replacements through the artery and vein in the groin.
Oh, okay.
Yeah.
That seems probably like easier for recovery, or it's just easier on the body.
It's definitely easier on the body, but it's got to be for the right patients.
Sure, it's a case-by-case situation. So I imagine over the years, some technology has been developed here. What types of procedures are you able to do that maybe patients may not be able to get at other hospitals or places?
Yeah, so the main operations that we're able to do now that were used to have a lot higher complication rates, but now some of the newer techniques, we're able to do more complex operations on the aorta. So we're able to replace now the entire aortic arch, the ascending aorta, the part of the aorta that goes up, the part of the aorta that goes around, and then even do the frozen elephant trunk portion of the procedure that goes down into the descending aorta to try to reduce the risk of aneurysm or rupture.
So if that could be your loved one or someone you know, there's things available here that could save lives, right?
Yeah, and we try to catch as many of these on screening as we can, but sometimes they come as emergencies and we take care of those as well.
Yeah, speaking of screenings, maybe somebody does catch something, and you say you need to have a procedure done. People might get a little nervous or scared about that. What are some of those common misconceptions when it comes to risk and recovery?
Yeah, so most people that come into my office are very nervous when they find out they need to have a heart operation. What I try to do is take all of their medical risk factors into consideration and talk to them about the operation. Most people number one fear is they're scared of dying.
Yeah.
With the way that we're doing cardiac surgery now as compared to in the past, most people's risk of dying from major heart operation, whether it be bypass, valve replacement, or what have you, is actually very low. It's usually 1%, 2%, 3%.
Oh, wow.
Of course, depending on what the patients have going on. So that's the number one thing. And then when we talk to people in terms of preparing for operations or just overall health and wellness, we try to tell people to try to stay in as best shape as they can, walk every day. If you can walk a mile a day, in general, your recovery from a heart operation will be much easier. Of course, no smoking, and to try to eat a healthy diet.
Yeah, so there are some things you can do to make that a little bit easier on yourself on the back end of all of it. Well, thank you so much for joining us today.
Yeah.
Interesting, and thank you for saving lives every day, right?
We try our best, of course.